us. We will begin in a couple of minutes. As you come on, go ahead and please check to make sure that your sound is on and that you can hear us okay. We're getting ready for the current Drug Medi-Cal Organized Delivery Systems Quality Monitoring webinar, and we welcome you. So a couple more minutes and then we will begin. Thank you.
It's been tried. It maybe there's potential people in the house. And stay ahead is landed, repeat, maybe pass that. Yep. The three of us are not loaded and ready to go. I don't know about this guy. I'm scared, how long we should be doing it. I do agree.
We're going to be muting everyone, but if somehow we've missed you, go ahead and please mute yourselves. Thank you. It's 10:02. Our participant list is growing. My name is Amy Peterson, and I will be guiding us through the Drug Medi-Cal ODS information for the webinar today. I'm the chief of the Managed Care Data Support section, and I welcome you all on this fine day. I hope you all had a wonderful Thanksgiving, and thank you so much for joining us. Next. I'd like to also thank a lot of the folks that put on this webinar. We've been doing this since April of this year, and speakers today are going to be myself and Dr. Eugene Stevenson. We're also going to have a guest speaker, Jonathan Hall, and Sarah Rivera. These are all folks who work with DHCS directly or for DHCS and are working on a lot of the quality data that is coming into DHCS. Our support team includes Atif Habib, who is the driver today, Sujun Kim, who organizes everything in the back, Samantha Van, who is heavy duty support. Abby Geber Selassie is out of the office today, and we have Brianna Saley, who helps with making sure that all of our webinars are published and all of the information is up on the web. And we also have another assistant today, May Sean Ang, who is a long-term member of our team and has joined us to help with monitoring the chats. So if you have any questions, do go ahead and paste it into the chat. If we don't know that question and are not able to answer it today, we will get to it through email, and we will also include a lot of the chat information that comes in for this particular webinar series. We make sure that those kinds of the information that is asked for is included in our FAQ page, and that again is posted up on the web. Thank you so much. Okay, next. Okay, our agenda today is quality monitoring standards and objectives. And we will be looking at the 274 expansion to the Drug Medi-Cal County's Managed Care Delivery Systems. So the 274 County DMC-ODS data submission standards and quality monitoring will be covered as well. And then we'll go over communication and next steps in planning. Next slide, please. This may look really familiar to a lot of you who have joined us on previous webinars. This is the objectives: receive and review those electronic data, transaction data from the managed care plans themselves, those counties, and also provide data. And it goes into the post-adjudicated claims and encounter system. We call that PACES. What that does is it monitors the CART EDI transaction data. We'll go over CART in a minute. There's a 274 data hierarchy, and you can see where it comes in, how it passes through, whether it's rejected or accepted. Those data files have certain amount of time to turn back around. It filters down, and then we are able to access it at the DHCS level. You can also see that PACE's data processing flow has the information coming from the managed care plans into our system through the DHCS SFTP. That's the secure file transfer protocol. It goes into PACES. PACES runs some protocols on that and then either rejects or accepts that data so it can come into our warehouse. And MIS-DSS, that is what we call our warehouse here at DHCS. Next slide, please. I'd like to introduce Jonathan Hall. He is going to be talking about the expansion to county drug Medi-Cal and the organized delivery systems. This is provider data, and he is the Network Adequacy Oversight Chief. Thank you. We can't hear you, sir.
Oh.
Go ahead and check your microphone and let's see. I'll let you know. Go ahead.
You hear me now?
We could hear
Yes.
you. You're just quiet. Yeah. Okay.
Okay. Yeah, let me move a little bit closer. Hear me now? All good? Awesome. Well, apologies all. It's the technical burdens we all have occasionally with these remote meetings, but thank you all for joining us this morning. If we can go to the next slide, please. So we will be discussing a little bit of an overview of the DMC-ODS 274 expansion status. This will be a overview of the timeline as well as a perspective into the next steps. So a little bit of context. The Behavioral Health Information Notice, or BHIN, 23042 was released on August 30th of this year with guidance and compliance standards for DMC-ODS plans to submit provider network data using the 274 standard. The goal of using the 274 data exchange is to standardize and enhance provider network access across all DHCS managed care data delivery systems. So this is when the guidance was released and what our goal for this guidance is. Now, how it impacts network adequacy is that the adoption of the 274 standard will allow for a more real-time assessment of plan provider networks as compared to the current annual certification cycle for network adequacy standards. So this will allow for, again, a more real-time, point-in-time assessment of provider networks. So in addition to the ongoing submitting of data via the 274 standard as part of the testing and eventual implementation processes, DMC-ODS plans must continue to submit provider network data via the Network Adequacy Certification Tool, otherwise known as the NACT, until the DMC-ODS plan successfully and accurately implements data elements of the 274 standard and DHCS determines that the DMC-ODS plan has achieved this milestone. The 274 standard will replace the NACT as the primary source for analysis only after DHCS issues a BHIN or other formal guidance to inform counties of this change. So it will be a phased-in transition from the Network Adequacy Certification Tool to adoption of the 274 standard, which will then be formalized with a Behavioral Health Information Notice itself. Also, DHCS anticipates 274 submissions for the CalAIM Behavioral Health Administration integration as well. So there will be multiple uses for the 274 standard. Next slide, please. Now that we've discussed a little bit about the timeline for the adoption of the 274 standard, how it relates to ongoing submissions and how that transition will go forward, we'll just cover a couple points here regarding kind of the perspective outline going forward. So the final 274 companion guide for the DMC-ODS plans was released on June 26, 2023, and updated on August 28th of the same year. So the final companion guide is available and is something that all DMC-ODS plans should have at their disposal. Beginning on November 1st, 2023, DHCS did implement a testing environment for plans to submit test transactions. Counties that have completed all testing requirements can begin submitting 274 files in production as early as December 1st, 2023. So that is just around the corner. So for those counties where this is applicable, the testing environment, or the testing requirements rather, if those have been met, 274 files in production can be submitted as early as next month. DHCS will continue to host monthly work groups to support counties during this transition. And DMC-ODS plans are expected to transition to the 274 standard by March of 2024. So this concludes a little bit of a wrap up of not only where we've been in regards to the 274 standard for DMC-ODS plans, but also where we are going. We recognize counties are in different stages along this process. And we will continue to support the transition until the successful implementation of the standard is complete. That concludes my section of this presentation. I know it was just a quick little update. Thank you all for your attention to this, and I will hand it off to Sarah Rivera.
Thank you, Jonathan. Sarah, if you are on, go ahead.
I am. Thank you. And thank you, Jonathan. So yes, I'm the project manager for the 274 expansion. So anyone on this call that has been involved with the monthly work groups, you should be very familiar with my voice. Go ahead, next slide. I will be focusing on quality standards that we will be focusing on as the counties go into as the counties start testing and going into production. There are subsequent slides that talk about future goals, but my focus will be on what we're doing now to assist the counties, our quality expectations, and how they get into production, and then our monthly quality checks. So for submission rules, this is pretty much the same for all our managed care plans. So upon completion of testing, there's 2 phases of testing for the DMC-ODS plans that they must pass before they go into production. So once they pass the 2 phases of testing, then they are authorized to go into production and start submitting the monthly file submissions. So once in production, monthly file submissions must be submitted between the 1st and the 10th, and no later than the 10th. Otherwise, counties will be flagged as late submissions, which ultimately could lead to corrective action plans. And we always encourage the counties and plans to submit early in this time range, because there could be some errors that need to be resolved, which means you'd need to resolve and resubmit. So we always encourage counties to submit early in this range between the 1st and the 10th, so that they can meet that 10th, so that they can have an accepted file by the 10th of each month. And that's for the previous reporting period. So when a county submits a 274 file to DHCS, as Amy had mentioned earlier, there's a whole series of edits that each data element goes through. these edits can result in a fatal error, which means the entire file is rejected and the counties must correct that and resubmit. There are some edits that result in a warning message, and we do ask counties to look at those warning messages. But the end result is it is the county's responsibility to look at the validation response file that DHCS releases after the file is processed, and that response file will tell that there'll be a status that says whether that file is accepted or rejected. It's the county's responsibility to look to make sure that file has been accepted before they identify that monthly submission as complete. There is also a requirement to submit what we're calling a production data submission reconciliation form, PDSRF. So this just provides basic information about your file, some counts, so that we can do a reconciliation to make sure what we receive is what you expected us to receive. And that is due no later than the 15th of each month. Later, this will be changed to a JSON format, but for now, it's an Excel-based document. Next slide. So this slide focuses on some common quality issues that we've identified, or the counties have identified, that result in their file being rejected. And so this is just a reminder to all the counties. The first thing, especially since the DMC-ODS plans, this is new. The first thing, if you submit your file and you don't get a response file from DHCS, look at the file name itself. It's extremely important that it follows the file naming convention that's in section 3.5 of the Behavioral Health Companion Guide, version 2.1. And I just put an example here of for Alameda, what the file name would look like. The biggest mistake that counties make is that dash between Alameda, where it says Alameda-DMC-ODS. People will receive files where that's an underscore as opposed to a dash. So that's the number, where we say put an underscore versus a dash, that's critical. Otherwise, we won't be able to receive the file. Also, in your interchange interchange sections of the file, it's critical that you use the names that we give you, the IDs that we give you. Again, that can result in your file DHCS not being able to process your file. Also, we receive sometimes other things in the 274 SFTP folders that are not your actual EDI 274 file. Your EDI 274 file ends in .dat as the extension. So if we ask you to send an Excel document like the PDSRF, we give you a location to send that. It's not intended to go into the SFTP folder. Only your 274 EDI folders will go into the 274 SFTP folders. So these are some common errors that we see that may result in your file not being processed at all, which means you will not get a response file. Next slide. Somebody has their mute not on. So for quality checks, so as I think Amy had mentioned, when a file comes in, we do a whole series of edits against that file, pretty much on every data element. So those are considered the first layer of edits that we get. We also perform what we call quality checks. And so this is looking for the reasonableness of the data. And this may be the types of edits or quality checks that you can't necessarily get through the initial EDI edits. So we're looking for reasonableness of the data. So as the DMC-ODS counties go through their testing and then into production, we are looking for, does this file represent a complete network for the county or for the plan? And we use the NAT data that was recently submitted to do that comparison. So that's one of the first layers of quality checks that we look at. So as the counties submit what we call as a phase 2 production parallel testing, we ask that they submit a complete full file that represents your full network for the previous reporting month. That's called phase 2. And we're using that file again to make sure it's reasonable. It represents what you submitted in the NAT, and we'll give you a response on that file on any corrective actions. So when we send a response on either your test file or your monthly production, you will get an email from DHCS saying, we looked at your monthly submission, or we looked at your phase 2 test production parallel test file. Here's the issues that we've identified, and we will give you a list of corrective actions and timeframes to correct. And counties can resubmit files for any reporting month. So it's a fairly easy process for you to go correct the data and then resubmit for that specific reporting month. So any plan, so when we send emails with timeframes, it's very important that counties look at those timeframes for corrective actions to correct the data. Otherwise, that could result in a CAP, a corrective action plan. Next slide. So I believe many of the individuals involved in the DMC-ODS transition were involved in the mental health plan transition to the 274. So we have had lessons learned. And so this is really just a list of some common issues that we've identified. And we ask the counties to make sure you're looking at these, because these are data elements that are used in the network, in the annual network certification process. But some of the common issues are the 274 files are not submitted by the 10th, or the PDSRF. So it's very hard for us to validate the monthly data coming in if it's not coming in on time, or if we don't receive the PDSRF. Licensure type is a data element that's in the 274. It's a California specific data element, not a national standard, but it's very critical for the validation that DHCS does. So we do look at that to make sure, one, if we see OTH, which is other qualified provider, many times we'll see that, but when we look at the taxonomy code for that provider, it's a valid provider that should have a valid licensure type, like a psychiatrist or a marriage and family counselor, things like that. So we do look at the licensure type. It's very critical that you report that as close as possible to what that provider is. Missing NPIs, we are planning, currently the NPIs is set to requested, which means you will get a warning message if an NPI is missing at the group site or rendering level. It is the intent of the department to set this to required, because the department believes that all behavioral health providers should have an NPI. It's not going to be set to required yet. It's one of our monthly quality checks that you'll see, because over time we do want to look a little bit closer to see, under what situation would a behavioral health provider not have an NPI, so that we can accurately set our logic and possibly bypass for that scenario. We also see not many, but some address issues. Either the city is misspelled or the zip and county don't match. So this is a quality check that you will see as part of your phase 2 parallel production file assessment, and then also as the monthly quality checks. Next slide. Some more quality issues that we've seen. Again, so just make sure as we go through this list that you're really looking at these data elements. But the contract dates, sometimes we don't see contract dates. And I think that we've set the edit a little bit more stringent, so there's more editing around it. But all provider group, site, and rendering providers should have the contract effective dates. And it's essentially the term contract, it's really the effective dates that these providers are for that reporting period. Facility types is very important. Sometimes we see the facility type code itself is a California specific code, not a national standard. But that is an important data element for our own internal reporting. Sometimes we'll see a facility type identified as an outpatient when it really is an inpatient. So make sure you're really looking at those facility types and the descriptions so that we can do our reporting on our side as best as possible. For inpatient and residential facilities, we are looking for bed counts. So make sure that that information is coded. American Indian Health Facilities, I'm not quite sure if this is applicable to DMC-ODS. I believe it is, but if we have plans or counties that are already previously identified as having an American Indian Health Facility contract, we expect to see that on the 274, and we've implemented a recent quality check for the mental health plans, and we've identified quite a few counties where they should have one, but it's not being reported on the 274. The ADA compliance indicator for sites, this is a new quality check that we're adding where if a site if this indicator is not set to ADA compliant, you may see that as one of the quality checks. And then we also see in many cases foreign languages missing in the 274, but in your NACT, foreign languages are identified. So another area to make sure that you're looking into. And then I already mentioned this, but any major discrepancies between the data that the plans have submitted in their NACT, we will be focusing on comparing the 274 data to the NACTs that were submitted in November. So part of the onboarding process, even before you go into production, we'll be looking at that information. And then monthly moving forward, just making sure that there's no major differences. Next slide. So yeah, so that does conclude my section, and we can go ahead and turn it over to the next speaker.
Thank you, Sarah. Good morning, everyone. My name is Eugene. I'm the Program Data Reporting Division Chief, and I'm going to go over the future data quality monitoring plan. Next slide, please. As been outlined a couple times already throughout the presentation, all counties and plants must submit all 274 data by the 10th of every month to the DHCS PACES system. When applicable, MCPD PCPA data must also be submitted by the 10th of every month to the PACES system. And as Sarah just outlined, the SRF future JSON file will also need to be submitted by the 15th of every month to the PACES system. Next slide. Even though this is CART, I'm going to actually go in a slightly different order, just to kind of get at the scaffolding approach that DHCS has to addressing data quality. The first is timeliness. As Sarah said, and other speakers have also said, data must be received on time. That is the first step in assessing whether or not a file is complete. So if it is there by the 10th, then the department can assess its completeness, which is the second level, which means that the department is checking for missing, surplus, or duplicate data. For instance, site data should report all essential details like valid city, county code, facility type, etc. What this is also saying is that the submission must comport to the shape that the department expects. That's really what this is saying, that the file came in, it has the essential elements that is necessary to be deemed complete, and can move on to the second or third level of assessment, which is accuracy. where the department starts checking for typos and questionable records. For example, cite email addresses that use forbidden characters. For instance, Etna@cizzix.com. XYZ is not .com is not an actual address. So if that address was included in the 274, then it would certainly be flagged. Taking one step back, completeness is a one-to-one. It either is complete or it is not. Accuracy is a little looser. However, it is usually fairly tight, somewhere between 2 and 10% of records received must comport to what the department expects. And then moving on to reasonability, which checks if the data is valid or plausible. And this has a fairly wide range historically when judging file types, or I'm sorry, judging file submissions, because it takes time in order for the department to assess whether or not what has been submitted is reasonable. Next slide, please. Quality review reports consider the submission timeliness of the 274 file in addition to several types of data quality measures related to reasonability, completeness, and accuracy. If ever there's a question regarding these 4 facets of quality, please send an email to the team and we can be sure to triage that effectively and get you the answer that you need. Next slide. Every month, data quality checks are performed on all 274 files. This also includes DMC-ODS plans. Each DMC-ODS plan will receive a report summarizing the results. This is standard managed care method. Right now, managed care plans get the same exact workflow with their monthly data checks. For example, a monthly data check covering the July submission for the June 274 network file is sent to the DMC-ODS by the end of July. So the department is reviewing the submission that was sent in the month it was sent and seeks to get those results to the plan by the end of the month. Next slide, please. The semi-annual data check serves as a way for data quality team to identify whether plans have corrected deficiencies that are identified in previous quality checks. So the semi-annual data check is a summation of the monthly data checks that have occurred over a 6-month period. If a plan has been found to be deficient in any one of the CART dimensions, then they are made aware and are given the opportunity to resubmit. The department goes back and does a review at a semi-annual place. So every July and every January, these semi-annual data checks are done. They look back over the previous 6 months to identify whether those deficiencies have been corrected. If they have not been corrected, then the semi-annual data check serves as a second deficiency, and that is generally where corrective action plans begin. January 2023 through June 2023. That would be essentially the data that we are looking at in July. The checks are identical to the monthly data check metrics and use the most recent submission for any particular month's data to make sure that data deficiencies have been corrected. So let's pretend that data was sent in March.
I'm sorry. I'm in the thing.
Thank you. If a data check is conducted in March looking at February data and it is deemed to have a deficiency, then when it is reviewed in July, the department looks at the most recent file. So if that file was sent in May for February data, that is the file that will be picked up. So you can rest assured that The semi-annual data check will use your corrected data in order to conduct the grading. Next slide, please. In the future, the submission reconciliation form will become a JSON file. It'll be due by the 15th. Unlike the 837-274 managed care plan data and primary care provider assignment file, or MCPD PCPA file, which are all due by the 10th. Next slide, please. DMC-ODSs must not include any rejected files in the SRF. Otherwise, the submitted file will be rejected. DMC-ODSs are expected to review all SRF warnings for warning messages, even when the file is accepted. And also DMC-ODSs must rectify any discrepancy warning messages and resubmit the file. Next slide, please. With that, I will turn it over to Amy.
Thank you so much, Dr. Stevenson. That was a lot to cover. Again, we are accepting questions from folks in the chat. We have Sarah Rivera standing by, and I believe Mr. Hall is still on as well. I'm going to go over some communication and some next steps information for you. I want to also direct you again to the website that we have the webinar posted. We're putting that information in the chat for you. All of these webinars are listed, they are recorded, and the transcripts are available as well as the slide decks. So each one of them in succession is available month by month. We make sure that those things are there for everyone who is either on the calls and wants to review them or who misses them. So next is the data group mailboxes for DMC-ODS related questions related to the 274. You're going to want to contact the 274 expansion at dhcs.ca.gov. These will be live links when we post the actual slide deck, so you'll be able to just click on it or keep it handy in your Outlook. The documentation center access requests, we get those, we see them coming in, we allow access for those. If you are having issues with access, it is posted in a SharePoint at DHCS. You contact the data exchange at dhcs.ca.gov, ask for access. We allow access, and if there's something wrong with your access, you might want to speak to your particular IT folks and see where options are. When you contact that data exchange email, you can actually ask for copies of the things that you need if you really cannot get access. For questions related to the webinar or questions related to the discussions that we're having in this webinar, you can go ahead and contact us at mcdss at dhcs.ca.gov. Any of these messages, please go ahead and mark urgent in the subject line, and we'll get to them and make sure that they get passed along to more folks. And again, as you post questions in the chat, we're going to go back and respond to what we can at the end of this webinar. So I'm going to get through the communications, but we will get to you folks. Next slide, please. So county liaisons and communication. You might know this. DHCS liaisons are currently not assigned to the counties for the 274 submissions. You're going to want to send all questions regarding 274 DMC-ODS to the 274 expansion mailbox, which is, again, 274 expansion at dhcs.ca.gov. We're going to host a monthly 274 work group for counties, or we host a monthly 274 work group for counties on the fourth Monday of each month from 2 to 3:30. I believe, Sarah Rivera, you're the host of that. So you're always welcome to come and join us there. Next slide. DMC-ODS contact guidelines. You're going to be limited to 4 plan contacts. That means that 4 people, trusted folks that you allow to have access to emails coming from DHCS, and they are the folks who disseminate those emails throughout your organization. So you're going to have a primary technical contact, and you're going to have a primary compliance contact. You really do not want to include contacts that your plans do not want to have access to certain information, for example, corrective action plans or other sensitive topics. DMC-ODS, should we assign a liaison on your end? The liaison will distribute as needed internally. So DMC-ODS will assign the liaison on our end. Next slide, please. Okay, we're going to cover some next steps very quickly. Go ahead. You can see all of the different data transaction types that are now in production. DHCS is in the testing phase for the DMC-ODS, as you can see. So I don't know, Sarah, if you have any updates for that right now, but this is as of the date of this particular webinar. We're still in the testing phase for counties.
Yeah, Amy, I would like to make one comment. Is that okay? Can you hear me?
Yes.
Okay. Yeah, so we are in the testing phase for the DMC-ODS plans. As Jonathan had mentioned, our test environment opened up on November 1st. So we expect all the DMC-ODS plans to start testing over the next month or so. We released a readiness survey on November 22nd. It's very important that all the DMC-ODS plans respond to that survey because it focuses on any obstacles or any issues you may be having in meeting the March 2024 production timeline, which is referenced in the BHIN for the DMC-ODS 274 transition. So we've started receiving some responses, but I'm just using this as another opportunity to remind all DMC-ODS plans to look for that survey and respond to it. Its responses are due by December 8th. And if the plan has not received an email for the survey, then send an email to the 274 expansion mailbox. But we will be sending out reminders as well. So yes, the testing phase has started, and we expect all DMC-ODS plans to be in production no later than March of 2024, as it was referenced in the BHIN. I think that's 23-042.
It's excellent memory.
Mm-hmm.
Next slide, please. We've been talking about the resources that we've been posting related to these webinars. You can find them on our page. There's a little screenshot of what the quality measures and reporting page actually looks like, and the quality webinar series is directly below. When you go to that page, you can click through glossary, FAQ page, links to all of the different webinars, recordings of the webinars. And so you can get up to date and refresh your memory on things that you need to know or that you need your staff to know. Next slide, please. Here's some live links for you. They're direct to all of these different products that we have been posting online with descriptors, and a lot of the information that you need, including your connections, your communication connections, will be live links on the particular webinars that you need as well. So when you open up the slide deck, you can keep that as reminder refreshers or cards. You can click directly into those links. Next slide, please. So our next webinar is coming up kind of early. It's because of the little smasheroo that we had with Thanksgiving and Christmas holidays that a lot of folks celebrate. And because of that, we want to give you ample time to have your time. And so we're going to go ahead and go early on December 13th. And that is going to be about the managed care program data, or MCPD, and the primary care provider assignment files, MCPA. So this expansion will be discussed on December 13th. coming up in just a couple weeks. This monthly data quality monitoring webinar series is usually held on the last Wednesday of each month. So normally it would have been the day before Thanksgiving. Normally it would be closer to Christmas, December 25th area. So we're going to go ahead and go early and give you some of your personal time and vacation time. We know people are off and we want to make sure that everybody can participate if they want to. But again, we post these on the web. Next slide, please. Okay, so the upcoming webinar schedule. Again, we talked today about the 274 DMC-ODS planning and processes and where we are in production and what's coming next. December, we're going to be talking about MCPD PCPA files and that expansion. January is coming up. It'll be the semi-annual data checks connected to corrective action plans. In February, it's the behavioral health short Doyle discussion and discussing information about incoming data from that. March, qualitative data templates. That's a really interesting one because that's essentially Excel data templates, and we have been transitioning information to JSON from a lot of those templates. In April, that will be a full year of these webinars. It'll be our first full year. We plan to go another year. Who knows? We may change topics, but the annual address from our deputy will be done at that time, and more than likely more address from Eugene Stevenson, who is a subject matter expert in this area and has been leading a lot of efforts here to ensure that things are done as expected and that people get the information that they need. This webinar is closely tied to his division, and we hope to be able to provide more information about DHCS data and other information that we collect. So April, there will be the annual address again from our deputy, Dr. Lynette Scott. And moving forward, we have more data information coming to you in May, June, July, August. So the next slide should talk to us about May, June, July, August, September. And we have a lot of information up here that we have already gone over this past year, but as things change, we'll update information. We may address other ideas and topics as well. So as you can see, this information is posted on our webinar page. You can look at see what topics apply to you and what you need to know, what your staff needs to know, and then participate accordingly. You can also go ahead and review the older slide decks and the older webinars. Next slide. So here we've come to our questions. I'm going to go ahead and scroll up a bit into the chat, and I know Sarah and Eugene and Jonathan, are you on? If there's anything there for you, or if you have any other questions, you may ask them here in the chat now, because I know everybody will be muted. Padma had a question about the 274 expansion, and is it related to a separate 274 file? And is that different than a regular monthly 274 file? And Sarah, I'll let you answer that.
Sure, I can take that. So the term 274 expansion, the initial implementation of the 274 standard was for the medical managed care plans, and that occurred in the 2017-18 timeframe. And then we used the term 274 expansion in reference to expanding to dental and behavioral health managed care plans. So for behavioral health, that meant the mental health plans and also the DMC-ODS pilot plans. So yes, these are separate transactions specific to the managed care delivery type. So today we talked about DMC-ODS as a managed care plan under behavioral health. They are required to submit 274 files on a monthly basis. And we're going through that onboarding process now. So I'm not sure if you're talking about the medical 274 files, but this particular webinar is specific to the DMC-ODS. And yes, the intent is for them to submit separate monthly 274 files that are applicable to the provider network for the DMC-ODS plans.
Great. Thank you, Sarah. From Donna, she had asked if we'll be able to get a copy of the presentation. And as I've discussed several times, you will be able to get copies of these slide decks as well as actual recordings. It takes a couple days to get it posted, but that slide deck will be posted on the web page that is live in the chat. Oleg has several questions. Okay, so general question for a report. That might be something that, Oleg, you can send us if it's something specific to one of your reports. But if a provider's prescribed a drug, the provider prescribed a drug, he has a provider number. I believe that is the MPI. To get a provider number, a provider has to be enrolled. I'm not sure about these questions. These might be questions that would be better suited for our email at MCDSS, and we'll go ahead and respond to Oleg through there. Looks like you're looking for a few directions in information related to provider definitions. Managed care provider networks may have a bit of a delay in reporting, but shouldn't. Yeah, we're going to go ahead and respond to you via email. And then Jeff went ahead and contacted everybody about providing information about the companion guides. And again, that's data exchange at dhcs.ca.gov. It's a mailbox. Yuk Lee asked if there is also a column for year next to month. I'm not sure what that is in regards to, but probably in the columns for the actual reporting. So Sarah, I don't know if maybe you could take that one.
So yeah.
Yeah.
Oh, go ahead. Yeah,
Oh,
I need more information to answer this question because I'm not quite sure which report you're talking about.
Yeah, I
here.
think she was talking about the webinar. Sorry, my videos having some bandwidth problems.
Oh, there we go. Okay, the webinar schedule. Yes, we're going to go ahead and compile them under each year. Yes, there will be.
And technically, the webinar schedule most likely won't change. So the topics that you see now will be the topics that will be covered next month, but the content of that topic will change. So even though we might cover encounter data quality, let's say every March, it doesn't mean we're talking about the same facets of encounter data quality every March.
But we will include it here once this one is over. Okay, are there any other questions? Let me scroll down a little bit. I think I'm at the end of the questions. If you have any last minute questions, feel free to contact us at mcdss@dhcs.ca.gov. I believe we're at the end of this webinar. We're going to give you a few minutes back. Is there any other slides, team? Are we at the end? We're at the end. Thank you very much, everyone. And we appreciate your comments, suggestions, and we will accept your emails, and Oleg will get back to you. Thank you so much. You guys take care.